We've always been triaging patients over the phone when they contact, specifically for coronavirus, and anyone that presented with respiratory symptoms or fever, we were asking not to come to the practice that the clinical staff would call them. So we've been trying to sort of triage those patients out of the practice, but still providing care to them, but keeping the practice as safe as possible for our other patients to be able to come in. With the new telehealth items that have come into place, it's been great because we can now contact any patient over the phone or via video link to continue providing those services. And we are doing most of that via telephone hookup. It's been really, really difficult to get a hold of webcams, and we still don't have any. So the doctors have been, great about bringing their own devices in. So some of them are using tablets or phones, and some of them are bringing their laptops in and hooking up video consult with the patients via their own device, and then obviously entering their notes into best practice on their desktop computer. And where that's not going to work for the patient because they don't have access for video link, we're just using the phone consultations.
I guess it's been a big and pretty steep learning curve for everyone. It's a big adjustment to shift to fairly quickly. Overall though, it's been a real positive sort of change for us and a useful addition to our practice. Obviously at the moment, with the COVID-19 pandemic, it's helping to keep us, our team and members of the community safe, while still being able to do all of our usual work, or most of our usual work, with our patients. It's having a really useful role, particularly for all of our fairly routine patients that we know well. A lot of that stuff we're able to manage really effectively using telehealth. It is a really efficient use of our time. It saves patients coming in for those smaller visits. The other benefit is that a lot of this was work that we were kind of already doing. So we were doing a reasonable amount of phone call follow-ups of results and things like that. Sometimes you would do small jobs for patients over the phone without seeing them. So in a way, this formalises and helps to fund some of that work that we're already doing. It's been a really useful addition to our practice. We'd really like to see it continue into the future as well, because it does help streamline our workday. It makes everything we do more efficient. It makes things easier for patients. And it just helps support that work that we already do.
Telehealth item numbers have been fantastic. From a nursing perspective, we've been able to contact patients who have chronic diseases and just ensure that they're all the preventative things, like are they social distancing, and do they have access to groceries, and making sure they're aware that how they can access medications and prescriptions. We want to make sure they're fully immunized against everything we can protect them against. So we're doing a lot of really, I think, more social support and preventative health activities that sometimes we don't get the chance to do face to face. So the telehealth item numbers have really expanded the services that we can provide.
Patients have been finding it really positive as well. We've been getting really good feedback from patients that they've been finding it really convenient. And they're very appreciative as well of us getting in touch with them, trying to keep the community safe, trying to keep things running, and doing it in a really smooth and efficient way.
It's been able to really give us an opportunity to provide that holistic care, that general practice, that's what we do.
The PHN is supporting general practices in lots of ways. Our PCIO team can assist practices with dealing with the MBS items, also identifying what we can do with telehealth within the rules and regulations of the government. Obviously that's been relaxed recently in light of COVID-19.
Some of the resources that are also available that I have found helpful are the health pathways. So there's a specific one for telehealth, which has a lot of links to resources that are useful.
So the PHN is providing a lot of advice through our health pathways program, lots of stuff around both telehealth and televideo health applications. We have also provided some small grants out to general practices to assist with uptake of telehealth in light of the MBS Medicare changes recently. My advice for telehealth application use or hardware, just consult with your IT providers first. They know your network setup. There's nothing worse than buying some products that then you can't use within your own network.